Vape free is the way to be. Don't vape away your dreams.
Assalamu alaikum ji. I'm Dr Farukh Saleem. I've been working in Social Security Hospital, Multan Road for about 15 years. I have graduated from King Edward Medical University and have completed my training of cardiology from Punjab Institute of Cardiology.
Okay, so our first question is that as a cardiologist, how would you describe vaping?
Vaping is basically a type of smoking in which there is a battery-assisted device which warms a liquid in that device. That liquid basically contains nicotine and it is dissolved in acetone, and it creates an aerosol which the user inhales, and it gets the same effects as a cigarette, excluding the contaminants like tar and other carcinogens that are present in smoking.
So what do you think are the common misconceptions about vaping?
There is a misconception that vaping is less harmful than traditional smoking. There is only this difference that it does not contain the contaminants in the cigarette, but it does contain nicotine, and nicotine is also harmful, and it causes endothelial dysfunction, raises blood pressure, heart rate, and it is detrimental for cardiac health.
Okay, many of the people who smoke, they want to quit it and they use vaping for that. So do you think that this is the best option?
Not really. It is not really the best option. It can be used to avoid the other effects of contaminants, but it's not really. And it can be used as an alternative to smoking, but it is not the right way to quit smoking, because it also contains nicotine, and nicotine, the liquid, a single cartridge of vape contains almost it is equivalent to 20 cigarettes, and you don't have an idea that how much nicotine you are getting when you are using it, as compared to a cigarette. When it's completed, you throw it away. But in case of this device, you keep on using it, and you don't have an exact idea that how much cigarettes you have, how much amount of nicotine you have used.
So what do you think are the cardiovascular diseases which are associated with vaping?
You can, first of all, it affects your blood vessels. It destabilizes the cholesterol plaques in your blood vessels, resulting in clot propagation, and it can result in heart attacks, hypertension, and stroke.
And what are the symptoms of these diseases?
First of all, their patient is going to get increased heart rate, palpitation. He can feel palpitation. He can also have shortness of breath due to heart failure later on. He can feel fatigued due to heart failure. He can feel dizzy due to decreased blood supply to the brain or heart failure. It can be a symptom of heart failure. He can have arrhythmias, irregular heartbeat that can result in dizziness and even syncope.
Okay, so which test would you prescribe to someone who are facing these symptoms?
If a person who is using vape or he's regularly smoking has symptoms of cardiac disease, which we suspect that it could be a result of some cardiac problem, then we'll get an ECG done, and we'll interpret it along with the symptoms and clinical presentation of the patient. ECG can show if patient is having chest pain, there may be ischemic changes in ST segments, and that could be a result of angina or myocardial infarction, that is heart attack. Or it can be due to some arrhythmia. There can be irregularity of heartbeat, and patients using who are chain smokers or using vape devices a lot can have arrhythmias.
Okay, so you have prescribed these tests. So at what time do you think, or at what stage do you think that these people who are facing the symptoms should get these tests?
If they are having symptoms, then they should get these tests.
Okay.
Otherwise, best policy is to quit it so that they don't develop any cardiac side effect or disease.
So what do you think is the healthiest way to quit smoking?
Healthiest way is to consult with the uh, correction facilities, along with the interaction with your family members, get their support. You can join groups that are quitting smoking, and in those groups they help you out, they share experiences. And the top of the line, you have to be self motivated. You should set a date that by this date I should be quitting it, and don't stop it immediately. You should gradually move towards, you should set small targets and then gradually proceed with it. You should be self motivated, and you should stick to your targets, and you should get an exercise. You should keep yourself busy so that you don't get the side effects of quitting, like you can get agitated, irritated, restless. And drugs can help. There are certain drugs like bupropion. It can be used in these patients to decrease the withdrawal effects of smoking. And along with it, there are nicotine gums, nicotine patches, and they can reduce the amount of nicotine being delivered to the body, and you can gradually taper it off from smoking, and they will also reduce the side effects and withdrawal symptoms.
Okay, so while we were searching, we saw recent reports about deaths because of vaping. So do you think that there's an increase in cardiovascular diseases or cardiovascular cases after vaping?
Not really. It is, you can say it is a relatively safer alternative of cigarette, and it is not yet recognized as a social drug abuse. The young people, like the teenagers, students, those who are more indulged in vaping, considering it a safer alternative to smoking, they don't have any idea that how much nicotine they are getting through vaping. You can't assess the amount you are taking, and if you get overdosed, it can result in seizures, it can result in convulsions as well if you
Okay.
get overdosed with nicotine.
Since we are talking about the teenagers, why do you think that most of the teenagers start vaping?
Maybe due to their company. Sometimes teenagers or students are sitting together, are in college. Somebody brings it and shows it like it's kind of recreational activity, but it's not really. It's really not. It can be uh, looked upon as an adventure for them. It's a new thing. Let's try it, and then they gradually get addicted to it. And people who are using it to quit smoking, gradually there is a study that shows that some of them do quit smoking, but they get addicted to it and may again start smoking as well.